Fewer Jackson, and I'm the Provincial Director of Programs for the Deaf and Hard of Hearing under NLESD. Joining me this afternoon is Tina Royal and Kelly Cribb, both who are itinerant teachers for the deaf and hard of hearing in our province. We're going to share some information with you this afternoon, talking mainly about supports for children and youth who are deaf and hard of hearing who are attending schools under NLESD. So thank you for joining us. So topics for today's session are roles of personnel involved in services for the deaf and hard of hearing, our training that we have in order to support your children, stats, our current stats in our province, some of the services that we provide. We'll also touch on resources and assistive technology that's available, as well as the partners and partnerships that we work with, and how services are determined, and how we set up programming goals, and we'll talk a little bit about building capacity moving forward. So under NLESD, the personnel that are supporting students, children and students who are deemed deaf or hard of hearing, my role, for example, the Provincial Director of Programs for the Deaf and Hard of Hearing. I work to support all of the teachers in the schools. We have a Provincial Educational Audiologist, which we'll talk a little bit more about in a few slides down. We have our Provincial Auditory Verbal Therapist, one that will support the Northeast Avalon, and the other who will support the Central, the Western, and the Labrador region. We have itinerant teachers and classroom-based teachers for the deaf and hard of hearing. We also have student assistants that provide support for children as well. And we have our IRTs, which stands for Instructional Resource Teachers, also known as our special education teachers, and our classroom teachers who we work collaboratively with. And we work with closely with our consultants at the Department of Education. And the acronym there is EDU. We are also very excited about new hiring, an ASL specialist under the APSI umbrella that's going to begin this coming September to support children and families who are communicating and accessing ASL. And I'm going to hand it over now to Tina and Kelly, and they'll carry on.
Thank you, Darlene. So typically, teachers for the deaf and hard of hearing are divided into two main categories. We have our classroom-based teachers, and we have our itinerant teachers. So an itinerant teacher would support a number of schools. So they offer support to our mainstream students, and usually that maxes out at about 5 hours a week. Our classroom-based, however, is assigned to one school, and they would support our deaf ASL users. And that's for students who need more support than what an itinerant can provide in the run of a week. And plus, it allows those students to have socialization with deaf peers and other deaf adults. And like I said, this is typically what happens, but unfortunately, it's not always set in stone as our numbers can vary. So Tina's going to talk a little bit about that, as what's happening in Central right now is a little bit different from what's happening in Metro. So Tina, if we could touch on that.
Yes, thank you, Kelly. In Central, what we have happen here is we don't necessarily have a classroom based where there are children who only use ASL to learn. So what happens is our itinerants end up being within a classroom in a school, and they will support that deaf child within the classroom. So it looks a little different outside of St. John's than it does within St. John's, but still the same supports would be put in place for that child.
Okay, so were we ready to move on, girls?
Yeah, all set. Okay, so what is an itinerant teacher? So an itinerant teacher is a teacher who travels from school to support our deaf and hard of hearing students. So itinerant teachers work as a member of the school team. We are also a go-between. We work with the educational audiologists. We work with audiology at the hospitals. We work with the assistive technology providers, speech language pathologists who touch base with the hospitals, and so forth. So we are an integral part of the service team for our children. We work with all students with a hearing loss, but the amount of service will differ depending on if a student is deemed to be core student, which will receive direct services, or a consult student. And I'm going to talk more about that a little bit later when we get into services.
We have an educational audiologist that works very closely with other audiologists in our province who would be under the health regions. Our audiologist, who is based in education, is able to conduct hearing assessments. She provides professional learning to itinerant teachers on the latest technology available. She supports all hardware and assistive technology that students use. This role also is able to troubleshoot equipment with the itinerants if things are not working as one had hoped. She's also able to provide loaner equipment when equipment breaks down, like hearing aids, could be audio shoes, those sorts of things. She's also responsible for keeping a database of equipment in collaboration with the Department of Education. She liaises with the hearing aid companies, to ensure that all equipment is up and running. And she provides transition support to students who are going on to post-secondary. So when our students are leaving grade 12 and going on to Montmarine, Kona, wherever they're going, we ensure that our students have the supports they need to make sure that that transition is as successful as possible.
And I will speak about the auditory verbal therapy. Within our province, we have 2 educational auditory verbal therapists. In order to be an auditory verbal therapist, you either have to have, be a teacher for the deaf and hard of hearing, a speech language pathologist, or an audiologist. And it's an extra certification that you've required in order to have the auditory verbal therapy certification. What an auditory verbal therapist will do in our province is we assist students with implants, mainly cochlear implants, to develop their listening and spoken language. We work collaboratively with itinerants and audiologists. So there's one in St. John's that will work directly with students and the itinerants, but our Central, Western, and Labrador auditory verbal therapist will work more collaboratively with the itinerant and also the parents to provide service. So that outside of St. John's is mostly a virtual service. And the itinerant teachers will also provide a PL in these strategies as well. And a lot of our itinerants are very well versed in the strategies for auditory verbal therapies.
So in addition to instructional resource teachers, we also have student assistants and teaching and learning assistants who work with our students. So for example, we have student assistants right now at East Point who are a group of deaf adults, and they support the use of ASL by our deaf children, and they help teachers in the building develop skills as well. So they are working with the students to provide information and support in developing their communication and also learning about their deaf culture. Our student assistants can also be there for safety purposes. So for example, our students sometimes have difficulty hearing fire alarms. They may have issues hearing cars if we're outside. So they're there to provide that safety support for them as well. And we also have student assistants for our deaf and hard of hearing kids who also have additional disabilities and exceptionalities.
So I'm going to talk a little bit about the training programs that are in Canada currently. So when an itinerant or classroom-based teacher goes off to do their master's, we have a program out of University of British Columbia, which is a master's program training you in working to support children who are deaf and hard of hearing. We also have a program in York University, mostly open to Ontario residents. They have an oral stream and an ASL stream, and that's a diploma program. And what I mean by oral stream is that the focus would be on the listening and spoken language piece, and the ASL stream would be on focusing on children who would be communicating in ASL. We also have a program out of Mount St. Vincent University in Halifax, and the majority of our students from Newfoundland probably would have gone to the Mount St. Vincent program because, of course, it is closer to home as well. And there was also a program at the University of Alberta. That program actually closed in 2005. So currently, we only have 3 programs in Canada that provides this training. And the York University is really open to Ontario with a couple of spots for outside applicants. So we don't have a whole host of places that offer this. Right now in our province, and this of course is based on current stats, we have 315 students in our K-12 system. And of course, we have to note subject to change with students who are graduating now this month and new referrals coming on in September. So, you know, it fluctuates from year to year. Some of our students would be deemed mild hearing loss. The majority would be somewhere between moderate to severe. And we have a smaller group who would be considered profound hearing loss. And within that profound hearing loss, we would have our students captured who would be communicating via ASL. So where are the majority of our students? Well, the majority of our students with hearing loss are educated in our regular classrooms in schools all over our province. As the girls alluded to earlier, we do have a program that started in September 2020. A small cohort of deaf children here in St. John's region that go to this program and are heavily supported by our deaf student assistants and 2 teachers for the deaf. And again, we have some other children throughout the province as well who also communicate in ASL, and they're fully supported with itinerant services, student assistants, and of course, instructional resource teachers as well. The allocation of these resources are as follows. So we have 19.5 positions for teachers for the deaf and hard of hearing. 3 of these teachers are classroom based, and 16.5 are the itinerant positions. And I always equate them to like our traveling teachers. You saw the trunk of the car there. They're going and serving clusters of schools where our classroom-based teachers are settled in one school and supporting the children there. We have student assistants supporting ASL development. We have 1 educational audiologist, and we actually have 1 auditory verbal therapist with an additional 1 coming on in September to support in a virtual way our students who have cochlear implants. And of course, we work very, very collaboratively with the audiologists in the health regions around the province to support our students as well with hearing loss. The locations of our itinerants and classroom-based resources are as follows. We have 1.5 positions in Labrador. We have 3 positions in Western. We have 5 positions in Central, and Central, of course, would be, you know, Grand Falls, Gander, all up that area, the coast, Twillingate, and all the way over to Bonavista and down the Burin Peninsula, as far east as Arnold's Cove, I believe. And of course, then we have the Avalon, which has 10 positions, and that's where the majority of our population of students with hearing loss sits. And as I said, we have our audiologist and our provincial ADT. Alrighty, and I'll hand it over.
All right, I'll speak a bit about the assistive technology, because with our students comes sometimes a great deal of assistive technology. So the majority of our students would wear some type of hearing amplification. It could be hearing aids, cochlear implants, BAHAs, which are actually bone-anchored hearing aids. All three of those are provided by the Provincial Hearing Aid Program. I believe that we may be one of the only provinces across Canada that actually supplies, free of charge, hearing aids, implants, and BAHAs. Also, within the classroom, you might see a personal FM system or a sound field system or hush-ups. I will speak about each of these now. And those three pieces of technology are through the Department of Education. In order to get access to those three types of technology, the personal FM system, the sound field system, and the hush-ups, you would go through your itinerant teacher for the deaf and hard of hearing through an application process with the assistive tech at the Department of Education. So your itinerant is the one that would fill out the applications. They would assess the situation in the classroom, look at how much, there's noise background, how big the class is. There's several factors that we go through on a listening environment profile that we look at in order to assess what piece of technology would be the best suited for that child in the classroom. I think there's some pictures. Here we go. We got some pictures. So I think it's soccer balls that are on the ear, the blue with the soccer balls. That is an actual cochlear implant, which is an actual surgery to have an implant implanted into the ear. The second one with the orange ear mold, that's a hearing aid. And the third one with the pink headband, that's actually another surgery type one. It's a bone-anchored hearing aid. So if a child has an issue with the middle ear, the bone-anchored hearing aid would be the one that they would use. And then we have the sound field system. The sound field system is one speaker in a classroom that amplifies the teacher's voice for everyone in the class. So that is usually worn as a Britney Spears mic sometimes, or you could use a Juno pendant microphone, which is around the neck. So sometimes you may see that as well. So you have two options usually for what you want to wear as a teacher. With that Juno sound field system, there's also a pass-around microphone, which is great if you're doing read-alouds with your class. Because generally, if a student is behind a student with a hearing loss, they have lost the ability for lip reading. So I find these pass-around microphones great because it amplifies the child's voice, which is usually very low, for the student with hearing loss in your classroom. So these are great for read-alouds. There's also what we call a personal FM system. And what that does is it's teacher worn, and it will it will transmit the teacher's voice directly to the hearing aid or the cochlear implant. It eliminates background noise for the student, the chair scraping, the kids, being loud in the class. So it eliminates background noise and distance. So those are great for students with more severe hearing losses and with implants, cochlear implants. And then we have what's called the hush-ups, which most people just say, getting those blue tennis balls. So these are hush-ups. What they are is just basically it's a tennis ball. It doesn't create mold. It's made to last. These are on the bottoms of the chairs and desks to eliminate that scraping noise that's in the classroom. I think there's a ton of schools with these now because we have had children go through with hearing loss in most of our schools. So these are great for reducing background noise and that scraping noise in the classroom. So as I said, all of these are through the assistive tech, and your itinerant teacher who is assigned to the student would be the one to fill out those applications and support teachers in the classroom to get those in their classrooms. Also this year, we have a new, with the COVID and everything that has gone on with COVID, we have a new medical mask with windows. What has happened to our students is we've noticed a lot of our students have had great difficulty because all of a sudden everybody's wearing masks and we have no lip reading anymore or no speech reading. So the medical masks with the windows have been sent to all of the schools with children with hearing loss so that the teachers can avail of these when they're in the class, and at least then the kids, the students with hearing loss, have that lip reading ability still. We have not taken that away from them with these masks. So that has worked out really well for some of our students and has actually been a saving grace for a lot of our students.
Alrighty, I'm going to talk a little bit now about our partnerships that we have. Of course, we work with the parents and the families and school teams to ensure that services are going as intended. We work with Newfoundland and Labrador Association for the Deaf. They have programming under their umbrella as well. The Family Communication Program, which supports ASL development. They have counseling for our children who are deaf. They offer American Sign Language classes. So we've partnered with them this year to offer classes in the Labrador region, in the Western region. We've had it previously in the St. John's region, and this will be an ongoing service that we will provide on an as-needed basis. We also avail of their interpreting services. So you might see some of the interpreters on the evening news, especially since the pandemic has begun. And so these interpreters are very valuable in meetings with families, also during classroom time. They're there to help bridge the hearing and the deaf world so that the children have as much access as possible. So that service will be growing even more now as the children get more skilled in using their ASL skills. We work as well with the Canadian Hard of Hearing Association of Newfoundland and Labrador. We call them CHA-NL. And they, of course, have been providing information to families on hearing loss. If you've not availed of their programs, I would certainly encourage you to check out both websites of NLED and CHA. As I've mentioned before, we work very, very closely with the regional health authorities, at the audiology clinics and our Gene Wing team. We're also always trying to ensure that services is streamlined when they leave health and move to education services, making sure that that's as streamlined as possible. And we also work collaboratively with the APSI organization, and APSI stands for the Atlantic Provinces Special Education Authority, and the governments of Newfoundland and Labrador, Nova Scotia, New Brunswick, and Prince Edward Island provide funding to the organization under provincial grants to ensure that services for our students or children who are blind and visually impaired and or deaf and hard of hearing get the services they need. So they've been very valuable partners to us as well. And just to give you a little bit more about the APSI organization, as I mentioned before, the funding comes from the 4 provincial governments. It is housed in Halifax. We've had children who are blind and visually impaired or deaf and hard of hearing attend programs there with their families for short-term programs, for comprehensive assessments. They've come down here as a staff and provided professional learning to our teachers. They offer, assessment advice to our school teams. We've worked collaboratively with them this last couple of years for sure, and that will only continue to grow. Of course, we had short-term programs set up for some of our students to go last May, and of course, all of that was shut down due to the COVID pandemic. But hopefully, in years to come, that's something that we can do where the children can be exposed to other children in other provinces with significant hearing loss. They also have orientation and mobility training for our students who are blind and visually impaired. And we also have an orientation and mobility specialist as well who works directly here in this province with our students who have vision loss. They house a database as well where all of these services and forms and templates and assessment things are kept, including audiograms, and they also have library resources that we can avail of as well. And for anyone who's still wondering where APSI is directly across from the IWK Hospital in Halifax. This building right here is where all of the teaching and learning would happen. I have actually attended some professional learning there myself over the years. And over here, the larger building would have been a residential building years ago that would house families, and even now house families and students that would come for those week-long programs. They could stay there and reduce the cost of hotel bills. And I'll pass it over.
Thanks, Darlene. So how are the level of services determined for us? So we're unique because we are one of the few school-based services that start at birth or the age of diagnosis, and we continue right up until school leaving. So that could be grade 12 graduation, or it could be the age of 21 when the students are ready to leave. And many times we actually still have contact with those students when they're in post-secondary, as sometimes they're going to need a letter from us. They need help getting equipment. They may have questions, and we're always kind of their go-to fallback person. So we do often hear from our kids in post-secondary education. So to add a student to our caseload, we receive an audiogram from the referring audiologist, and that's with parental consent. And once the parents sign off on that, they send it to us, and that's all we need to add students to our caseload. So core or consult. So core means we provide direct services to our students, so we see them one-on-one, and that can be up to 5 hours per week. So in some instances, it's 1 hour a week. Sometimes it's 1 hour every 2. Sometimes it's up to 5. It really depends on the needs of the child we're talking about. Consult means we keep in contact with teachers or parents, but the service is a little bit different. We'll drop in monthly or once a term or once a year, again, depending on need. So when deciding on the type and level of service we provide, we look at several things. We look at the level of hearing loss. We will conduct language and vocab assessments to determine if there are any gaps and if those gaps are indeed related to the hearing loss. We look at their academics, and we look at how well they use their technology and their assistive technology. And we also look at how well they can advocate for themselves in the classroom. So when we do an assessment, if we feel that the gaps are not hearing loss related, we will refer on to guidance or ed psych or sometimes SLP to do further testing. So the more need we determine, the more services we would provide. So we offer face-to-face and virtual support. So in-person support, face-to-face, that can be done in the classroom. It can be done pull-out, where we would take them out of the class and work with them in a quiet setting, or it can be a combination of both. And since we work with a young population, it's not only school setting, it can also be a daycare, and it can also be a home or wherever the parents and the itinerant decide is a good place to meet. Virtual has certainly come on stream lately, and it has come in handy because we have a lot of students spread far and wide, and it's not always easy or makes sense to drive to them or fly to them every week. So we can now offer virtual support to those students, so they are getting the sessions without missing out on that itinerant time. So we look at if the student is able to hear and comprehend well enough through the technology, and if they are focused and capable of doing online learning, then that's something we can offer for them. So what services do the itinerants and classroom-based teachers provide? So for both our core and consult students, we would do equipment checks. That's if they have it. So not all kids with a hearing loss actually have hearing aids. They don't all have assistive tech. It depends on their level of hearing loss. But if they do have it, we would check on their hearing aids, their personal FMs, their sound field systems. As Tina mentioned earlier, we would do up the applications for the assistive technology. And as Darlene mentioned earlier, if something breaks or a kid has an issue with a hearing aid, then we can arrange for loaners with our educational audiologist. We would also provide a list of strategies and accommodations to the classroom teachers, and that list is extremely long. There's just a couple here listed, But for example, we would tell our teachers not to give listening tasks on a CD. We would want them read to the students using a live voice. They have to make sure that there's adequate lighting in the classroom. Keep your beards trimmed. Don't talk to the board when you're writing on it, and the list just goes on and on. But that's something that we would provide to the teachers at the beginning of the year and also include in the IEP. We would offer PL to the school staff, again, to go over all those things. Okay, next slide, good. So for our core and direct students, who we would work one-on-one with, we would do all the things I previously mentioned, but we would also work on goals that are related to their speech and language as determined by an assessment. And that can be spoken language, signed language, or both. So it can be ASL, speech, or both. We know as itinerant teachers and classroom-based teachers the common gaps related to different types of hearing loss and the different degrees of hearing loss, so we are equipped to work on those. We offer up curricular support. We find our students can miss a lot of information in the classroom, as the classroom these days is very fast-paced. So you have a teacher talking, students talking, papers rattling. So sometimes it's hard to follow that for our students. So we would often ask our teachers to provide copies of notes so that our students can follow along instead of having to have their head down and trying to write. And they can also focus on the teacher for lip reading purposes. As itinerants, we also pre-teach some of the vocab that the students are going to face in the classroom so that when they walk in for a lesson, they're already semi-prepared. So the words, at least, they recognize and have heard them before. And that's why we often ask for copies of course outlines so that we can go over those things with our students. And we also help with written assignments because we often find that the kids will have grammar mistakes that are related to hearing loss. We have to pre-teach, we have to teach those concepts directly to them, and so we work on those types of tasks. And that curricular support gets more important as they get older, we find. We also work on vocab as identified by an assessment. So our students often don't pick up vocab and language incidentally, like hearing kids. So we need to direct teach it to them. And oftentimes they have speech gaps due to being unable to hear certain sounds. We work on those as well. We work on reading comprehension activities. We find sometimes our students can have lower comprehension, and that's mainly due to the vocab and language gaps that we've identified. And we work on listening skills such as following directions, auditory memory, auditory discrimination, and listening comprehension. And we also support the expanded core goals. So it's not just about academics for our children. We also want them to understand their own hearing loss and how we hear in general, different types of hearing loss and so forth. We want them to understand the technology that they use and then how to troubleshoot it if something goes wrong. We're not there every day of the week, so they need to learn those skills for themselves. We work with them on self-determination and self-advocacy. So we ask for, say they need to move, ask for closed captioning. So to ask for the things that would help meet their needs within the classroom. We help them with social, emotional, and mental health. Having a hearing loss can be a type of a loss. There is a grieving process. And some of the students struggle with that at the beginning, and some students struggle with that throughout their entire school careers. And we find as the kids get older, they notice they're different, they don't want to be different, and they can reject their hearing aids and their sound field FM systems, their personal FM systems. So we try to work with them on that to just tell them to own it, to be who they are, and to accept their hearing loss and embrace that. We also do transition planning. So we do transitioning into kindergarten, from school to school, and into post-secondary or the work world.
Thank you, Kelly. We'll move on now to building capacity. So we've been working a number of years now on growing skill sets all around the province. Currently, we have at Gander Collegiate, for example, Tina, who's here on our presentation, offers a credit course at the high school level in American Sign Language. And certainly Tina has, inspired some young folks to probably look at careers in, whether they want to be an interpreter for the deaf or hard of hearing, a teacher for the deaf or hard of hearing, an audiologist in this region. There's all kinds of careers that could come out of this field of deaf education. We're working, as I mentioned a few slides back, we're working closely and collaboratively with NLAD, the Newfoundland and Labrador Association for the Deaf, and with the Canadian Hard of Hearing Association, NL chapter, because there's things that we can all offer and bring to the table to ensure that services and supports are taken care of. There is conversations underway regarding an introductory course to deaf and hard of hearing education at MUN. This has been on the go for some time now, but of course with the pandemic and meetings and other responsibilities, it sat for a little bit, but it's certainly something that we're absolutely looking at partnering with York University and coming up with an introductory course to our young teachers who are coming out to have some training around hearing loss and how that impacts learning, so that if they end up in a classroom where there is a young person with hearing aids or cochlear implants, it will be much easier to bridge that with our itinerants when they walk in and start supporting that teacher and the student. Of course, we're going to continue with our collaboration with APSI on short-term programs and building our skill sets in assessment. And that's been ongoing for a number of years as well, and we'll continue to do that. Moving forward, I think it was Tina said earlier about our provincial hearing aid program. In my role that I've been sitting in here, I've done a lot of, talking back and forth to various provinces regarding how they support their children and youth with hearing loss. And I have to say that I think as a province, we are doing really, really well with offering assistive technology, hearing devices, all free of charge, of course, to our children in the school system. I've been working on a working group for the deaf and hard of hearing to improve our services. We're not perfect by no means, but we're working through some of our hiccups, with the geographic challenges that we have in our province. Recommendations have gone forth to our government under Health and Education and under the Disability Policy Office to see how can we make things even better. We certainly are aware and cognizant of succession planning for ensuring that positions are replaced. And I am absolutely thrilled that we have 8 teachers right now currently at the Mount St. Vincent University program who are doing their master's in deaf education. So this year we have some retirements that have come up. We knew that they were due. And I think we're in a very good place as a province to ensure that as these retirements come, that we have teachers ready to fill those positions. We're certainly about strengthening our partnerships. We know that we can't work in silos, that we need to work together. And I'm really pleased with how things have moved forward in the last number of years to make the service stronger and better than ever. We want to thank you for your time today. I know it was a long presentation, but I hope that you are able to glean some valuable information out of this. Certainly, you probably have lots of questions going through your head now, and that's fine. What we would ask you to do is certainly connect with the regional offices here, wherever you are in the province. Connect with the regional offices and say, hey, my child has a hearing loss. I'm wondering what kind of supports. Certainly this presentation would give you some idea of what your child may be able to access. And as the girls clearly outlined, it certainly depends on a number of factors, the level of service that we would provide. Connect with these regional offices and ask, can you speak with an itinerant teacher for the deaf and hard of hearing? And I'm sure that they would pass on information to you to ensure that The other thing that you can do is go into NLESD's homepage, their website, and if you click on the regional offices, you will see all of these itinerant positions and their names posted there for each of the regions. So if you know who you need to speak to, you can certainly drop an email, pick up the phone, and call. And we're there to support your children as best we can. What we often say is, we're here to give these children a leg up to ensure that they're as successful as possible within the financial means and the services that we're able to provide. I think we're doing a really good job as a province in doing that. So thank you for your time this afternoon.